Well, hello and welcome everyone to another session in the Solid Finances series. Just a couple of announcements here as we get started. Um, Before we kind of get into the main session today, first of all, I want to thank our sponsors, same as they've been all year: Montana State University Extension, University of Idaho Extension, North Dakota State University Extension Service, and South Dakota State University Extension. So that's where most of our content for this program is coming from, and then we have financial support from the FINRA Investor Education Foundation. Some of you what are participating at a local hosted site, and if you're at one of those sites, please take a moment to thank your local host for making this available to you in your local community in that format. So we certainly appreciate those folks. Just a reminder, we do archive all of our old recordings on msuextension.org/solid finances. We also keep our upcoming schedule there, contact information for the main contact person in each state, and mine is there as well. So if you have a question, comment, idea for a future session, finance-related questions, send those in, and we'll certainly get back to you via email, but it may also be something that we develop a session on in the future as well. And then all the handouts for each session are also stored there as well. So I just want to remind you that that's there. And then one final announcement before we jump into today's session. I want to thank each of you that took the time to fill out that evaluation following the last session we had, which has been a couple weeks ago. So we certainly appreciate that input on how we're doing, ideas for future sessions, and things we can improve on as well. So definitely thank you for those of you that took the time to fill out that short survey. We've got a couple of different tools, and I know a couple of you have used these already today. If you've got questions, comments, clarifications you want to hear, please send it in through the question and answer pod. That will only come to myself and our speaker today. So we won't announce your name, so feel free to ask honestly and openly any questions you have, and we'll just say we've had a question come in, and then we'll answer that question. So please tell us what you're thinking, and we'll try to get back to you there. And then we're going to have a few polls today to learn a little bit about you all and ask some things that way. So feel free to vote. And again, it's anonymous how you vote. So we'll just see the group results when you're done, and we'll share those as a group. But again, it'll be anonymous. So just some ways we can interact with you through this webinar platform. The next two sessions will be our final two for the 2016 calendar year, a week from today. Carrie Johnson from North Dakota State University Extension will talk about health insurance options for those nearing retirement. And then on December 14th, we'll talk about healthcare savings accounts and flexible spending accounts. So mark your calendar for those two. And then we won't do one until after the holiday season. We'll start back up in January. So do mark those two on your calendar if you haven't already done so. All right, I'm going to introduce today's speaker, keep it pretty short here, but Dr. Nancy Porter, currently with University of Idaho Extension, but has been with some other extension services throughout her career, and is quite a wealth of knowledge specifically about this current program she's going to talk about today. So with that, Nancy, I'm going to turn the floor over to you, and she's going to tell us a little bit about Small Steps to Health and Wealth, which I think is just a great program, because the more I've learned about finances, I learned there's some linkages with some other things, and this is one of those other linkages. So Nancy, it's all yours.
Thank you, Joel. Hi, everyone. It's great to be back with you. There are a lot of connections between your health and your wealth. Both positive and negative habits start small, develop slowly over time, and take time and effort to change. Americans are experiencing diet-related health issues such as heart disease, obesity, and diabetes more than ever before. Many Americans are also experiencing financial issues like excessive debt and low savings. As we become increasingly aware of how the food we eat and our physical activity level connects to our health, it's important to also know that healthier lifestyles can lead to increased wealth. Improvements in health can reduce the amount of money needed for health-related costs. Lower debts and increased savings can reduce stress and help prepare for health emergencies. But changing behavior in either health or finances can be hard work, but small steps taken to accomplish goals are often successful over the long term. So we're going to do our first poll so I get a little bit of a sense about my audience. So if you would feel free to choose one or all of the ones that apply to you that describe your health status.
All right, Nancy, it looks like most folks have weighed in, and most people are getting enough sleep, and about half the folks are getting the amount of exercise there, and little less are in the acceptable weight range, and most people, about 60% or so, are saying their stress levels under control.
It might not be a good time of year to ask about stress level, but anyway, getting a good night's sleep, exercising regularly, watching your weight, and keeping stress in check are great healthy strategies. But just as important, what's good for your body can also be good for your finances. So let's take a closer look at some of these areas. Research continues to point to growing connections between your health and your finances. Data from a variety of studies and research groups indicate that regularly getting a full night's sleep has been linked to receiving higher pay. Regular exercise also fattens paychecks. Heading to the gym at least 3 times per week has been linked to an increase in pay of 7 to 12%. Losing weight and improving cholesterol levels can save on life and health insurance premiums. There may also be financial incentives provided by employers for improved health. Smoking and chronic health conditions like high blood pressure and diabetes increase medical expenses, which means less money available for savings and investments. So let's look more in depth at these similarities between health and finance issues. We all have issues. We like to say people have issues these days. So let's see how similar they are. First, problems develop gradually. According to USDA surveys, American caloric intake has risen gradually over the past 20 years, and physical activity has declined. This results in weight gain and related health issues. A comparable financial example is permadebt, which is permanent revolving debt balances on credit cards with increasingly higher interest and/or fees like late payment fees or over the balance fees as balances rise. Next, for both health and wealth, there is less stigma due to increasing frequency. I think there's less body shaming today. I often think of the changes that were made several years ago in the sizing of women's clothing. Women's clothing that is now labeled a size 10 is really the same as what used to be a size 12. There's also more acceptance of bankruptcies today. The President-elect of the United States has filed for bankruptcy. And people want quick fixes. The health and financial fields are both ripe for claims of miracle cures and instant results. One reason that it's not easy to make behavior changes the hard way. Unfortunately, many product pitches are outright scams, such as lose 30 pounds in 30 days or stock pump and dump schemes where fraudsters hype an investment, get victims to buy it, sell it for a profit, and then leave everyone else holding the bag with losses. Changing behavior is hard. First, self-improvement goals often seem so impossible. And second, procrastination is easy. Tomorrow always seems like a good day to make behavior changes. I'll wait to eat more nutritiously after the holidays, or I'll wait to save money after the car loan is paid off. And third, even after taking the first steps, it's really tough to stay motivated to achieve long-term goals. And there's a need for routine checkups. Regular medical screening tests such as colonoscopies, PSA tests, mammograms are essential for maintaining good health. And when diseases are diagnosed in the earliest stages, patients usually have a better prognosis than those who are diagnosed later. Periodic fiscal checkups are equally as important as routine physical exams to monitor progress, identify needed action, and diagnose problems such as high consumer debt ratio and other problems before they get any worse. Continuing on, personal traits can equal success. Whether it's losing weight or preparing for retirement, People with a positive attitude have an edge. Why, you say? It's really quite simple. If you expect to succeed, you will succeed. Seeing results, pounds lost, dollars saved, debt reduced, is a powerful motivator. Other personal traits that have been shown by research to be associated with success are locus of control, optimism, spirituality or religion, and having a tangible goal or a sense of purpose. People fear drastic changes and large numbers. Recommending that everyone walk 10,000 steps a day or save 3 months of living expenses in an emergency fund just may be overwhelming. Many people fear major lifestyle changes so much that they freeze and do absolutely nothing. It requires ongoing maintenance. Health and wealth should never be taken for granted. Even after achieving long-term goals, periodic maintenance is required. Recommended health maintenance activities include eating a nutritious diet that follows recommended dietary guidelines, regular physical activity, and adequate sleep. Recommended financial maintenance activities include regular deposits to retirement savings plans and an emergency fund of at least 3 months' living expenses. And there's lots of technical jargon. Simply put, many health terms and financial terms, especially those acronyms like HDL and LDL for cholesterol and 401k and 403b and NAV or net asset value for mutual funds, are very technical and can seem like a foreign language to many consumers. And we need more point of purchase information for both health and wealth. Now, nutrition labeling has helped a great deal, but on the financial side, it's really more difficult. Anyone who's read an investment prospectus will agree that maybe we don't need more information, but information in a more easily understandable format. And the last three that I'm going to talk about today, advice needs to be realistic. Eating a healthy diet can be more expensive and can make it difficult for Americans to meet the nutritional guidelines. But there are less expensive ways to eat healthy, like including canned vegetables instead of using out-of-season fresh vegetables. Some financial advice, such as saving 10% of gross pay, may also be unrealistic for some people. Also, drastic solutions have major drawbacks. Liposuction, gastric stapling, gastric bypass surgery can reduce weight quickly and have health benefits. But there are many risks associated with any major surgical procedure, including death. Bankruptcy is a last resort, drastic measure for a debt crisis, and it'll stay on your credit history for 10 years, making new loans difficult or, at the very least, more expensive with higher interest rates. So lastly, the good news, bad news. People invest in their health through healthy lifestyle choices like physical activity, just like they invest in wealth-building assets such as buying stock or saving for a college education. Health and wealth are related in another important way, longevity. People who practice healthy behaviors decrease their risk of dying prematurely. The flip side of this, however, is that those who follow a healthy lifestyle also need to accumulate adequate wealth so they don't outlive their assets. Health behavior decisions have enormous financial implications. So the bottom line, taking small steps can lead to success. Being told to lose 50 pounds or save $1 million for retirement, who wouldn't be afraid to get started? With a small steps approach, anything you do to improve your health or accumulate wealth is a step in the right direction. No step is too small to get started, and you can never be too early or too late. So let's drill down a little further on the issue of weight and finances. I really found this interesting. Research has shown that men who exercise 3 times a week are likely to receive 7% more pay, and women who exercise 3 times per week are likely to receive 12% more pay due to improved energy levels, better mental sharpness, and improved mood. There are other financial benefits, including reduced health expenses. On the flip side, there can be more financial costs, including gym memberships, shoes, clothing, equipment, the list goes on. And looking even further, a 2012 study published in the International Journal of Obesity asked participants to evaluate resumes that had photos. And overweight candidates received lower starting salaries and were said to have less leadership potential. On average, obese workers earned 2.5% less than those with normal weights. Obese Americans spend an aggregate of $30 billion extra on clothes. And a 40-year-old obese man will pay twice as much for a life insurance premium. When you're carrying extra pounds, the extra expenses add up, starting with health care. Researchers have tracked healthcare spending by body mass index levels, another one of those acronyms, BMI. The average annual cost for a person with a low BMI of 19 was $2,541. With a BMI of 25, considered overweight, it was $2,893. At a BMI of 33, that is deemed obese, the cost topped $3,439 per year.
And Nancy, maybe this is a good time where I jump in. We had a couple questions come in. And the questions are, I'll read them to you kind of at once because I think they're related. So, is there a correlation between a gym membership and pay? And what was that correlation between weight and pay?
Yes, there is the correlation, although it wasn't necessarily gym membership. It was just exercising 3 times per week. And that came out of the July 2016 issue of Money Magazine, which was, the whole title was called Get Healthy, Get Wealthy. So that's a good resource for you to look at.
Great, thank you.
So the Small Steps to Health and Wealth program that I worked on when I was at Colorado State University was developed originally by colleagues at Rutgers University in New Jersey. It explores common strategies that can be used to improve both health and finances. While changing behavior in either health or finances can be hard work, small steps taken to accomplish goals are often successful in the long run. So this webinar is a bit different from some of the other Solid Finances webinars that you might have viewed. And I have 3 main objectives today. First, I've already given you areas where your health and your finances commingle throughout your lifetimes. What happens in one area of life affects the other. And next, during the webinar, we're going to look at some of the small step behavior change strategies that can be applied simultaneously to improve your health and your personal finances. And then last today, I want to motivate you to take action. Simply reading or hearing about the change strategies won't change anything. The goal is for people to write health and or wealth goals and to begin taking small steps to accomplish them. Now, today I'm going to focus more on the financial side of the Small Steps program because I'm not a registered dietitian, but I want you to know that the program was written and reviewed by registered dietitians in several states. The overall goal of Small Steps to Health and Wealth is empowerment. In other words, I want to encourage you to appreciate the power that you, and you alone, have within yourself to take action to improve your health and your finances. And to get started, there are really just 4 basic steps. Set realistic goals. Now, we have talked through many Solid Finances webinars about setting SMART goals: specific, measurable, achievable, realistic, and have a timeline. So it's the same is true for health and wealth. You need to put a date and a number on each goal, like save $5,000 over 3 years toward the down payment on a new car, or increase physical activity to 30 minutes a day, 5 days a week, by the end of December 2017. Then you need to identify small, doable action steps, like increase savings by an additional 1% of your pay, or increase activity by walking 10 minutes a day for the next 5 days. Then identify obstacles and make plans to overcome them. Anyone who's tried to change their behavior knows there are always obstacles. For example, if a lack of discipline is an obstacle to your saving, get deposits automatically deducted from your paycheck. If commuting is eating up available exercise time, look for opportunities to exercise on your breaks or your lunch hour. And then last, put your mind to it to support a goal with all of your focus and energy and take action. So this slide lists the titles of all 25 of the Small Steps to Health and Wealth Program behavior change strategies. Now, while the strategies are all written in user-friendly, plain English words, they're actually grounded in dozens of empirical research studies and research models related to changing behavior, as well as recommended health and financial practices. Now, we won't have time today to look at all of them, but that's okay, because we never suggest that someone take on all 25 strategies. You might look them all over, pick a couple that you'd like to try, and then if one works for you, that's great, but if not, try another one until you find success. And every behavior change strategy in the Small Steps to Health and Wealth workbook has accompanying worksheets to help you implement this strategy to improve your health and or your wealth. And I've given you a few examples of worksheets that we did at Colorado State as examples in your resource list. Awareness of both one's current habits and the possibilities for self-improvement is an important component of change. The purpose of the Track Your Current Behavior strategy is to help you become more aware of how much you eat, move, and spend throughout a typical day, week, month, even a year. It's necessary to establish a starting point from where you may choose to make small changes. Keeping records of eating, activity levels, and spending can be tedious, although there are some great tools now online and that you can wear on your wrist to keep track of some of those things for you. However, losing this awareness can lead to a disconnection between health habits, financial practices, and goal achievement. Sometimes it's easy to ignore negative eating or spending habits, even if we know that they could be harmful to our health or wealth. For example, we often believe that we eat better and are more active than we really are. Keeping eating and activity records gives us an honest picture of our lifestyles. Likewise, tracking income and expenses can reveal where our spending plan has leaks. By keeping track, we can see little things that are nickel and diming our budget surpluses into deficits. Creating annual net worth statements help us see the big picture of our finances. Once you're aware of your own habits, you can compare them to expert recommendations. In the health arena, there are a lot of guidelines developed by government health experts, like the Dietary Guidelines for Americans, it was out in 2010, and Physical Activity Guidelines for Americans in 2008. The Solid Finances webinar series provides you with many common personal finance guidelines. Having an emergency fund of 3 to 6 months expenses or more, depending on your health, employment, or other risk factors. Having a consumer debt ratio of less than 20%. Now, this is your monthly non-mortgage debt payments divided by your monthly take-home pay to come up with your consumer debt ratio. And we recommend that it's less than 20%. Your credit reports, having no late payments or other negative information. Having a credit score of 720 or higher on the FICO scale, and that ranges from 300 to 850. Or net worth, and a little guideline is that you take your age times your pre-tax or gross income and divide that by 10 to come up with a recommended net worth. So now we're going to go to the second poll. I want you just to think back a little bit, and are your money management strategies more similar to how your mother managed money, how your father managed money, how another relative managed money, or I do not manage like any member of my family? Okay, it's looking out there that moms have a lot of influence. Those of you who are mothers, you should take that to heart and think about how you're influencing your children. I smile when I talk about this behavior change strategy because the Rutgers program called it Unload Your Childhood Baggage. At Colorado State, my registered dietitian colleague thought that that was really negative to talk about unloading childhood baggage, so we renamed it to consider outside influences. So, however you phrase it, your emotions, childhood experiences, and outside influences can affect your health and personal finance experiences for better or for worse. So I'd just like you to just take a couple of seconds and think about, what is your first memory of food? And then the same thing, what is your first memory of money? I like to do this with groups, and I think it's great when we can share, but I'm sorry that we don't have the chance to do that. So I'll share that my first memory of money happened about this time of year, and I was pretty young, maybe 8 or 9. My mom and I were going Christmas shopping. And before we left, she had to ask my dad for money because he managed all of the finances and her name wasn't even on the checking account. So I think I made the decision early on that I wanted to have money of my own and not be totally dependent on anyone else. And another early memory also came around Christmas time because my grandparents always gave me a $5 bill. Now, I'm getting up there, so that was a long time ago, but I wanted to spend it. And I remember poring over the Sears and Roebuck catalog, but my parents always managed to get me to the bank to put it in my savings account. Now, I'm a saver today, and I should be thankful, but I can honestly say I don't think I always appreciated that influence. And for food, I was definitely a member of the Clean Plate Club, never wasting food by leaving it on my plate. I pretty much still eat that way today, and I find it really hard not to finish everything put on my plate, even when I'm at a restaurant and there are really huge portions that they serve. But other health examples might be, some people believe you can't change bad genes, or no matter what I eat, I'm destined to be overweight. Or on the financial side, we often hear the love of money is the root of all evil. Or your net worth equals your self-worth. And we all have some of these ideas in the back of our head, whether we consider them childhood baggage or whether we consider them outside influences. Once you recognize these beliefs, the next step is to really turn them into positive health and financial messages. And for those of you who said that you're not managing money like any relative in your family, you've probably decided to go a different path. It's best to keep things simple and easy to understand when making changes to your health and finances. Positive action is more likely to occur when we have information that is easy to follow and apply. So in the health arena, research indicates that people understand portion sizes better and may be motivated to eat less when food portions are mentally compared to the size and shape of common objects. This is where I think the health might be a little bit easier to implement this strategy. But portion size measurement aids, such as a deck of cards equals 3 ounces of meat, or the size of a baseball equals 1 cup of salad greens. And that's a baseball, not a softball. A softball is much larger. And a golf ball is about 1 ounce of nuts, and 4 die equal about 1.5 ounces of cheese. And being able to equate these in your mind have been found to significantly improve estimations of portion sizes. So some of us think, gee, I don't eat that much. But in reality, the portions that we are eating are really much larger than the recommendations. Now, in the financial arena, we suggest that you convert recommendations stated as percentages into dollar figures so that they're more easily understood and are more personal to your financial situation. So for example, a guideline is to buy a house that is no more than 2.5 times your annual income, or that you need to plan for at least 80% of your pre-retirement income per year in retirement. So if you can translate and calculate those figures into actual dollar figures in your specific financial situation, the research tells us that it's going to be easier for you to follow. A popular strategy to reduce consumption, and thereby save calories and or money, is to follow the step down to change principle. Instead of eliminating a food or a discretionary expense entirely, you choose a lower calorie or a less expensive alternative using a staircase graphic to visualize your alternative. So Alina Johnson at Utah State University developed the concept of stepping down to reduce household spending. To illustrate the concept, she developed a graphic that shows 5 ways to buy pancakes. The most expensive method, the top of the staircase, would be to go to a sit-down restaurant such as IHOP or Denny's. Or you could step down by going to a fast food restaurant. Or you could use microwave pancakes or a pancake mix. At the floor of the staircase would be the least expensive method, making pancakes from scratch. But at any level of the staircase, people still get to eat pancakes, but at a price they choose to pay. Without feeling deprived, you're not cutting pancakes out of your life, you're just choosing what price you want to pay for them. Now, like that, you can also use the step-down principle to reduce caloric intake of your favorite foods. And in Colorado, we added this one to step up to change. So you can also use this to look for ways to step up your progress toward goals. Take the goal of increasing your savings. The first basic step could be saving extra change in a jar. Then you step up to putting any savings that you get from using coupons or rebates into your savings account. The next step would be stepping up to adding lunch money that you save by brown bagging it. Then save bonuses, refunds, gift money. And then the highest step might be to start a payroll deduction. By stepping up gradually, you'll miss the money less and end up saving more. Now, while we typically think of the word supersizing in relation to French fries and soft drinks at a fast food restaurant, the just say no to supersizing behavior change strategy can apply to all types of purchases, both food and non-food. For example, the buy two, get one free offer at a bookstore or an office supply store or the grocery store really is a type of supersizing. Food portion sizes have increased over the past 2 decades, and consequently, total calories consumed have also increased. From a consumer's viewpoint, larger portion sizes seem like bargains. You get a lot more food for not much more money. So what can you do? Just say no to meal deals. No matter how much of a better deal upgrading a food portion size appears, simply order smaller portions. You'll save both calories and money. Ditto for non-food spending, such as lower prices per item when you buy 3 items when you really only need 1. Offers that require people to spend more to save money need to be scrutinized carefully. Now, this strategy is a little bit more difficult. I find that people really think they can't do math, but it makes it a little bit easier. The number 10 is a powerful number and fits the small steps approach to changing health and wealth behavior. It's easy to multiply, divide, and remember. It's small enough not to discourage people from taking action, and it's large enough to make an impact over time. The number 10 or multiples thereof, 10 times 10 equals 100, also shows up repeatedly in numerous expert recommendations to improve health and increase wealth, like eat 100 calories less per day and save 10% of gross income annually. A great strategy is to strive to make progress every day. In other words, do something, however small, to bring you closer to your health and or financial goals. Any small step to improve your health or increase your wealth is better than doing nothing. It's hard to stay motivated and on track all of the time. Many times we fall off the wagon by overeating or overspending and just give up. Pretty typical at this time of year. So give yourself a break and continue on. Tomorrow is another day. So I just wanted to show you part of the key planning department that we developed at Colorado State. There's a copy included in the resources for this webinar. So as you learn new strategies and try them, you can adjust your plan. This worksheet helps you write down your goals and visualize your life after achieving your goals. It has you list obstacles that you may encounter along the way and helps you think ahead of time on some ideas of how to avoid those obstacles. It makes you think of 2 or 3 small steps that you can begin to take, then to set progress dates to check in with yourself. So a good hint is that determining an appropriate reward for yourself may also help you be more successful. And then, although the Nike sneaker company has used the "Just Do It" marketing slogan for years, the fact is that these words alone aren't enough to motivate people to change unless they're already committed and actively preparing to do so. Before someone can adopt new positive health or financial behaviors, they need a firm commitment to change and a plan of action. In other words, you need to take the time to prepare properly, beginning with taking steps to identify and address obstacles. In addition, don't set yourself up for failure. Start dates and quit dates to take action should be realistic. Right now in early December is not a good time to go on a strict diet or to quit smoking if you plan to attend many holiday social events. Ditto for saving more money right before the holidays. You might wait a few weeks so that you can begin to change health and financial behaviors with fewer distractions. However, now is a good time to look over the small steps materials and create a plan for yourself that you'll begin in January or at some other predetermined date. So that was just a quick overview of a few of the 25 strategies. So I just would like to get a feel if any of these, which one of these do you think might be a strategy that you could try?
And while people are voting, I'll just remind folks if they've got a question or a comment, please feel free to send those in to us. All right, it looks like we've gotten quite a few votes in. Looks like a few folks are going to track their current behavior. Most are going to step down or up to change. A few are going to say no to supersizing, and a couple are going to try, or some are going to try the power of 10, but nobody's going to compare themselves to benchmarks or use an easy frame of reference.
Okay. Well, I really like the step down or step up to change. I think that's really a great strategy. The say no to supersizing, it's just so easy, especially at fast food. They say, what size do you want? You're not even thinking about it. But then it just really amazes me that they give you a cup and there's a machine that you can just keep refilling your cup. So upsizing it to a larger size and paying more money doesn't even make sense then. So I just find it really fascinating. So I wanted to give you some more resources for the strategies that I talked about today, or any of the other 25. The resource list has these 2 specific links. The national page for Small Steps to Health and Wealth at Rutgers gives you access to the entire downloadable copy of the Small Steps to Health and Wealth book. It's completely free. There's also monthly health and wealth messages to help keep you motivated and remind you, and some videos. And it also has a bibliography of the research behind this program. So those of you who are asking about some of the research basis, it's really very interesting. And the Colorado State homepage provides self-study guides and videos for 13 of the 25 behavior change strategies. We just didn't feel that we could tackle all 25 of them because we were conducting programs and evaluating participants. We just didn't think we could do all 25, but you can get all 25 at the Rutgers site. And this is what the homepage for the Small Steps program that we created in Colorado is what it looks like. And that's where you can find those self-study guides and videos for the 13 behavior change strategies that we used. But I did want to tell you that our follow-up research with participants found that the program was effective in helping people change both their health and wealth behaviors when we followed up with them 3 months after they completed a program. So I sped through. I probably could have added a few more strategies, but you don't want to overwhelm you with too much of that. And as I say, they're all available so that you can go look at them and try some of them and see what might work for you. So I hope you'll check them out, and I hope you'll find strategies that will work to help you improve your health and or your wealth. And maybe you don't feel that you need to improve your health, but you want to work on your wealth, or vice versa. You want to work just on your health, but you will realize some gains between working on one. But working on both simultaneously really with the strategies works very well.
All right, Wealth, we're gonna do a couple of evaluation questions here because we like to get a little bit of feedback, and maybe I'll ask you all too to think about while you're doing this. If you could share in the comments pod, which we'll put back up here in just a minute, maybe one thing that triggered in your mind today about a small step to either health or wealth that is a goal for you, or something you might be thinking about trying, or something you've tried recently. So, and again, we won't share your name on that, but if you want to share that with us, or if you have other questions or comments, we'll flip back over to the main screen, and we'll give you a chance to take those, to send those comments and questions in. All right, give everybody just maybe 4 or 5 more seconds here, and then we'll switch back so we can get those comments shared among everyone and any questions still that we have out there. Right, let me go ahead and make this a little bit bigger here. Please feel free to send in, some of your questions, comments there. While folks are typing on that, let me just remind people that a week from today, we'll be back same time on a Wednesday at 12:05 Mountain Time. And Carrie Johnson will join us, and she'll talk about health insurance options for those nearing retirement. And on December 14th, we'll talk about healthcare savings account, flexible spending accounts, and how that will kind of the tax benefits of those and what situations those might work best for people. So I had a couple of comments come in here. We had one person say that they take the stairs was a change that they made a couple years ago. So that's a great step. If there's any other comments, we'd certainly like to hear those. Maybe we can share with folks. And Nancy, maybe you can share one or
and parking further away from your office or whatever also adds more steps to your day. I don't have a Fitbit. I've been fascinated to read some of the research on really how accurate they are, and different ones are more accurate than the others of keeping track of steps. So I feel like I have a pretty good handle on my finances. It's probably the health that I would like to work on more.
All right, and we had somebody suggest here they like the 10 suggestions and setting goals. It appeals to their mathematical mind. Another one person, they like the idea of taking small steps and not trying to do drastic methods to eat healthy and lose weight. And following up on your comment, Nancy, I think maybe that's part of MSU's plan. As parking has gotten a lot tighter in the last few years, they force us to take a few more steps, whether that's part of our small steps plan or just part of parking being tight, but you certainly get a little more exercise than you did 10 years ago.
Well, it really does benefit the employer to have healthy and more fiscally responsible employees. So there may be, whether they're offering, that's also the other thing that's sort of new as to whether employers are offering a financial incentive for people to get healthy. The flip side of that is how much do you want to divulge to your employer about your health status? sometimes people want to be completely separate from that, but there are several companies that are offering financial incentives for being healthier.
Mhm. And I know the Montana University system, we have an employee wellness program, and it's certainly followed along these lines that Nancy was talking about, of taking some small steps and linking, I would say, some broader well-being things to health well-being in addition. So, well, it looks like we've got most of the questions in. So, Nancy, I just want to say thank you for presenting today. And to everyone else, I hope you got something useful out of today's session. And I hope you'll mark your calendars for a week from today and 2 weeks from today. Hope everybody has a great day, and we will see you next week.